Welcome back to another episode of The Mix. As always, I'm your host, Nes Nyoenta. In today's episode, we are going to be talking about non communicable diseases, in short, NCDs. And Mr. Kondwani Chira is going to talk more about these NCDs. So, if you want to know more, stay tuned. Okay. What do you mean when you say non communicable diseases and what causes them?
So non-communicable diseases, basically, we are talking of diseases which are not infectious. You cannot pass them to another person like we do with HIV and AIDS, the STIs and other infectious diseases. So these basically are diseases which solely, mostly they are caused by lifestyle. And other causes may just be genetics, like you have inherited them from one of the family members.
Yeah.
Yeah. For example, if maybe your parents had hypertension, which is high blood pressure, a disease of high blood pressure, there's a greater chance that you may also have it. So basically, that's what we mean when we say non-communicable diseases.
What are the major risk factors for NCDs and how can they be prevented?
So risk factors, we would like to group them into two categories.
Yeah.
The modifiable ones and the non-modifiable ones. It's really important to know this kind of categorization because whenever we are preventing or we are trying to treat, we mostly work on the modifiable category of risk factors.
Yeah.
So on the modifiable, we have like lifestyle, like eating habits, okay?
Yeah.
Not exercising, some people just say they do not exercise. That also gives you a risk factor of some diseases like hypertension, diabetes. We have smoking, which puts someone at risk of maybe let's say cancer, the hypertension. We also have alcohol. This also puts someone at risk of other communicable diseases. So, yeah, in short, these are the most common modifiable risk factors. Whilst on the other category, we have genetics, as we said, where family can pass the disease to the next generation.
True.
We have things like age. You cannot modify your age. There are some diseases associated with age. For example, the cancers. If you're older, there's a higher chance. Even a stroke, if you're older, you have a higher chance of having stroke, unlike the youth, because they are more active and they tend to do other things in a better way than elders. We also have gender, or maybe say sex. There's some things which highly happen in a particular gender. For example, breast cancer, there's a higher percentage in females than in the males.
Yeah.
Yeah, so those are the non-modifiable ones. There's really nothing you can do about them. Yeah.
So what about the modifiables?
The modifiables, as I said, they are those ones: smoking, diet, exercise, alcohol. Those are the ones which are the modifiable risk factors. And sometimes occupation also, like the environment. Maybe you work in a particular setup where there is maybe radiation, whatever, which can predispose you maybe to certain cancer. So you may need maybe to change and work in a better environment.
Yeah.
Yeah.
Okay, so what are the types of NCDs?
So I think the best way we can answer that question is to answer according to the system that they affect.
Yeah.
So we have some non-communicable diseases that affect the cardiovascular system. Basically, this is the heart and the blood vessels.
Okay.
So we have diseases like hypertension, the heart failure, the coronary artery diseases,
Mm.
the stroke, the atherosclerosis. Then we have other non-communicable diseases, which we can just call them cancers, like the breast cancer, the lung cancer, the prostate cancer in males, the skin cancer. And then we have others which affect the respiratory system. These are chronic respiratory diseases like asthma, emphysema, chronic obstructive pulmonary diseases. And then we have others which affect the neurological, which are neurological in nature, like Alzheimer's disease. These are mostly seen in the elders. They tend to forget things. They even forget they have lit fire somewhere, so they may be involved in accident.
Yeah.
We have epilepsy, multiple sclerosis or Parkinson's disease. Then we have others which are like the endocrine disorders, the type 1 and type 2 diabetes, and in women we have polycystic ovarian syndrome,
What?
uh, polycystic ovarian syndrome, PCOS, the famous PCOS. It's mostly seen in women. Other people have classified it as a non-communicable disease as well. And then we also have mental health conditions like depression, anxiety disorders, bipolar disorders, schizophrenia, and the PTSD, the post-traumatic stress disorder. These are also classified as um, you know,
Not
non-communicable
communicable diseases.
diseases. Others are just like maybe the liver disease, the kidney disease, the sickle cell diseases. Yeah, those are also termed to be non-communicable diseases according to uh, sources like World Health Organizations and stuff.
What do you mean when you say social determinants, and what are some of the social determinants of NCDs?
So social determinants, basically, we are looking at how a human is relating maybe to other people or and maybe the environment itself, social. Okay, we're looking at the relationships of people. So, for example, in the mental disorders, um, you see that there is an element of social to
Yeah.
it. Yeah, for example, family, relationships.
Community.
If these things are not working, these may affect somebody's mental health. Yeah,
Yeah.
if someone is stressed, if someone is displaced, they are not working, they're just somewhere, they're just dormant. They may even develop some of the non-communicable diseases. For example, we have talked of hypertension.
Mm.
This one really doesn't go well if someone else is stressing. You know, some
Mm.
people's BPs go high because they are stressed, they're thinking about something.
Yeah.
So socially, that would not be a favorable condition for them. We have other things like dependency, where someone, you're depending on someone, then
Yeah.
yeah, and then a loss happens. Yeah, so that loss may affect one's mental health, and then later on, these people may suffer from what we call PTSD, like post-traumatic stress disorder.
Mm-hmm.
Like your past keeps on replaying and replaying, and it feels fresh
Mm-hmm.
each and every time.
Mm-hmm.
Um, yeah, so these things tend to affect our health in terms of non-communicable diseases.
Okay, so what are those social determinants?
So we have talked of family,
Yeah.
we have talked of relationships. Um, I don't know, but then other people combine it. Like when it comes to social economic status, it's kind of combined as an economic factor and both as a social factor. Uh, um, Education as well is also one of the things which is very important in communicable diseases.
Mm-hmm.
Some people are not knowledgeable enough on how they can prevent some of these non-communicable diseases. Like for example, here in Malawi, we at least now people are trying to work on maybe their body weights, but we used to believe the greater the weight, the richer the person,
Mm-hmm.
uh, which was not even doing us any good when it comes to the cardiovascular diseases.
Yeah.
Yeah.
How can you describe poverty as the social determinant of NCD?
So with poverty, um, from the angle of education, it needs money for someone to get educated.
Yeah.
Yeah. And from a disease point of view, one also needs money to um, obtain some of these healthcare services. I will tell you that treatment for NCDs sometimes is very expensive. It is expensive, and sometimes the public hospitals may not have them, and one needs to buy.
Yeah.
So for someone who already has the disease, for example, diabetes or hypertension, they need to control and monitor their sugars. So for someone to have a glucometer to monitor their sugars or to have the medication itself, they need money to buy it from the pharmacies, which is quite a burden to most of the citizens, the Malawians. So poverty really plays a bigger role when it comes to the NCDs. Even if we talk on the government level, if you want to launch a campaign or conduct a campaign pertaining to these diseases, you need funding. You need a lot of money. If you want to do a research about the NCDs, you're gonna need a lot of money for it. So if you do not have money, the country will not have up-to-date information pertaining to NCDs. If we do not have up-to-date information through research, we'll have poor ways of preventing and treating these diseases, and this will increase the burden of NCDs in the country. So poverty really plays a big role on multiple levels.
Okay, so what are some effective strategies for promoting healthy behaviors and lifestyle changes to reduce the risk of?
Yeah, so I believe the World Health Organization had some programs put in place. There was one of them which was aiming at ending or dealing with some of the NCDs by the year, should be 2020 or 2030.
Yeah.
Yeah. And then there are also what we call SDGs. I don't know if you have heard about them.
No,
Yeah.
I've never.
These are strategic developmental goals. Okay, so there's a SDG number 3.4, which talks about ending mortality caused by NCDs. So the World Health Organization, as the world at large, those are the plans which are put in place. Now, each and every society, each and every country has to make sure they fulfill those SDGs according to the environment. For example, our strategies here may not be as same as those in USA.
Yeah.
We have to make ours here which fit our environment. So here in Malawi, there's not much literature which is written about these things, but we have seen campaigns being done about the NCDs. We have seen uh, departments in the hospital where they have a sickle cell special campaigns where they call for the patients who have such kind of conditions, so that they come for treatment, they come for screening. We have also seen this element of NCDs being incorporated in other health services. So that, for example, you come to the hospital because you're having fever. As a medical profession, I have to measure your BP.
Yeah.
I have to get your sugar levels, so that in case you are going towards diabetes or hypertension, we should pick it up early. So I think this is what we are doing here in Malawi. It has its own challenges, but at least it's helping. Yeah.
You talked about a global thing, they're coming together.
Oh, okay. So I like the World Health Organization is one which runs health stuff at like at world level. Yeah. So they come up with plans. Okay, for example, let's say the way we had, let's say, polio, they would have goals like, let's end polio by this year, or let's eradicate polio by this year. So they set plans for the world at large. Now, each and every country will have to adopt that and come up with policies which will help them fulfill those goals according to the problems of their environment. For example, you cannot take a strategy for malaria and then do it in UK. maybe they don't have malaria at that side.
Yeah.
It means it only fits here. But at world at large, the World Health Organization wants to end malaria. So the same with the NCDs. They have strategic development, uh, like SDGs. We call them SDGs. 3.4. It says ending or lowering the mortality caused by the NCDs. So with that goal in mind, here in Malawi, we have to find ways. Okay, what are our problems? Okay, we have poverty. Okay, we have education
Yeah.
and as an issue, and then we have maybe the environment as an issue. So it means if we want to fulfill and prevent NCDs, we have to deal with poverty. And then you go back to SDGs. There's another one which talks about poverty.
Poverty.
Yeah. Knowledge. We have to educate people, meaning we should incorporate NCDs in our curriculum. That's why people are able to learn about curriculum. Uh, when it comes to educating, it means maybe even people at workplaces, they should have a time where they can learn about these things. Because trust me, uh, if you see a lot of workplaces, I've seen maybe the police, at least those people exercise. At least those people exercise. But most of office people, you see them having
The
sports
managers.
day. Yeah, they will have sports day so that they encourage their workers to exercise. So if we deal about with these things, at least we are getting closer to um, the solution and the goal which the World Health Organization has. Yeah.
So do you think it's going to reach its goal of ending NCDs?
So I cannot absolutely say we can end NCDs. I cannot say that because, as we discussed, we have other factors that we cannot modify.
Yeah, true.
Yeah, like the genetics and what. But at least we can lower the numbers to a certain level. Because I think I was reading somewhere to say, like our budget here in Malawi is behind like the occurrence of the NCDs. So we have more NCDs and less money.
Oh.
Okay, and maybe we'll discuss later on. They cause a great burden. So if you can lower the burden, other things can be running smoothly.
What role do policymakers and government play in addressing the NCD's burden? And what policies have been shown to be effective?
Okay. So I think these big people, some of them politically
Political leaders.
oriented.
Yeah.
They have to come up with policies. Um, one important thing these people play is the budget, the money they allocate to the health sector,
Yeah.
so that we deal with the NCDs. And as I said already, the money and the diseases so proportional.
Yeah.
At this point. I think this is according to the paper which was published last year, to say the monies that we have and the diseases that we are having, so matching. The diseases are ahead of us. So these people come in handy when they are allocating the money to say, let's allocate more money in this sector, let's allocate this amount of money in that sector. So those are the people. When it comes to policy, for example, we talked of smoking as one of the risk factors.
Yeah.
So these are the people that say, okay, let's make a policy where people don't smoke in public so that they don't affect other people who are not up for smoking.
Yeah.
Okay, I'm saying it's political because you cannot say, okay, let's stop manufacturing of cigarettes. Someone would ask, why can't we just stop them from manufacturing cigarettes? But you see now there's money, whatever,
Yeah, true.
taxing and whatever. But then we can control. One of them is saying age limit. Okay, don't smoke when you're below 18.
18,
Yeah. When it comes to, let's say, drinking, say don't drink while you're below 18, or some bars can be closed to say, okay, don't go beyond 9, or don't go whatever, don't drink whatever, so many bottles. So those people are the ones who come in handy to come in and make policies and laws that can encourage health behaviors. But then, of which policies work, um, I think the best one is the education part, where you get people to get educated,
Yeah.
incorporating in syllabuses, curriculum, and maybe making banners and posters. We see adverts that encourage people, okay, let's exercise, let's do this and that. Those ones really wake. They wake. But then the burden is very high to an extent that if you measure the success rate, it'll still be somewhere low. But we know at least we're getting there.
Okay, so you were talking about the political people who allocate money to different
They're the ones
sectors.
who come up with budgets. Uh, yeah, they're the ones who come up with budget and they make the laws. Yeah, pretty much it's them.
Yeah, true. But then I was about to ask you, do you think they should allocate more money to her sectors than other sectors?
Yes, I'll say yes, because if someone is not healthy, they may not go on the road and construct the road. They may not go and do other developmental works. Okay? I'll give you this example. There's something that we do. We say disability adjusted life years. Okay. For example, if your life expectancy is 40 and then you have the disease at 20, okay, it means you live with the disease for 20 years.
20 years, yeah.
Okay. That's like the disability life years for you. Okay. If you die at 20, your life expectancy was 40.
40.
We have lost 20 years.
20 years, yeah.
Okay. So, for example, you have hypertension at 20 and your life expectancy is, let's say, 80. It means for 60 years you'll be burdening the government to be giving you medication for 60 years.
Wow.
You see now? So it
It's
means
burden.
whatever you were able to do
Yeah.
before you had the disease, now you can't do it as much as you would have done it.
Yeah, true.
It means development and everything is going down. But if we had money allocated and then we screened you and then we caught it earlier and then you got helped, you did not reach the hypertension stage or the diabetic stage, we have saved 60 years and we have saved money for medication for 60 years, which now we can allocate to the road construction, stadium building, and other things. Yeah.
How can technology and innovation be leveraged to improve NCD prevention and care?
Yeah, I think we're living in that day and age where um, communication is being done through um, technology.
Yeah.
Yeah. As we said, education is one of the most important thing. How we disseminate information. So we can use the technology that we have to disseminate information about the NCDs.
Yeah.
We can also use the technology, advanced technology, to screen for these diseases. At first, you couldn't, because for you to screen, let's say, sugar levels, we need advanced technology where we can detect how is this person controlling their BP. Okay, we have to even use technology to treat some of these diseases. For example, the atherosclerosis. Okay, you have to
I'm
remove
sorry, can you say that word again?
atherosclerosis.
Atherosclerosis.
Sclerosis. It's like the blood vessel has hardened.
Yeah.
It cannot dilate. It cannot what, and it's injured because there is a lot of fat, okay, in the lumen, which is the hole itself.
Yeah.
So there's a lot of fat, and then this can also lead to the other conditions like stroke and hypertension, because now the space is small. So hypertension is all about the space is small, the blood vessel cannot dilate, and a lot of blood is passing through with pressure. So that's hypertension basically. So if it's passing with pressure, maybe this can burst or it can be blocked completely and the blood may not reach the other part of the brain, which will lead to stroke now. Yeah. So if we have technology, we can be able to tell, okay, which part has been blocked, okay, which part is affected. So we can use technology to detect some of these diseases. For example, the sickle cell. Now we are able to screen to say, okay, if this person has sickle cell. Even people before marriage, they are able to go for sickle cell screening so that you know whether you have a gene for sickle cell, so that you don't burden the child who is to come. Yeah. So yeah, it's really important. It's really important. And I remember one of treatments when it comes maybe um, the mental issues. One of them we use electricity actually.
Oh.
Yeah, we call it ECD. You put some rods in the head and then do some electricity transmission there, and then it works. It works. Okay. So technology is really one of the important thing in this NCD category, both for prevention and treatment.
You talked about ECT. What does it stand for? ECT.
Electroconvulsive therapy.
Oh.
It's like you're trying to induce a conversion in a person using electricity for therapeutic reasons. So it's mostly used maybe in depression, maybe some mania. Yeah. So if you go to Zomba, you may have an experience, or maybe if you suffer the disease, we can try to do that to you, so that
I reject
you
that.
have an experience, first-hand information.
Yeah, true.
Yeah.
How do NCDs impact individual families and communities?
hmm So we talked about the economic part.
Yeah, true.
Okay. Even the productivity of the family in the community at large. Someone was working and now they have maybe diabetes, or they have some mental conditions, or they have hypertension. They may be restricted to do other maybe stressful works.
Yeah.
So the productivity of these people will go down,
Be
and this will
reduced.
imply that they are dependent. They will be dependent to be provided for, to be taken care for.
Yeah.
Like they have to be bathed, some of them, and it means they'll be burdened to the family. Instead of progressing, they will have to be stuck on this person, and in some families it brings about, even some depression to the guardians and other people. And we talked about money. It means these people have to spend money taking care of this person. Yeah. So that's the burden which can be there to the family and the community.
Okay. Okay. What are the most promising areas of research for NCDs, treatment, and prevention?
So here in Malawi, I wouldn't say we have done more research on this regarding NCDs and uh, how they go about it, how to treat them. But I've seen some research being done on maybe sickle cell.
Yeah.
Some doctors have tried to conduct research regarding sickle cell, the hypertension, and then the diabetes. But I would say we are still in infancy in as far as research is done. I think it's one of the areas where we have to focus on, because research helps us to know, realize the gap, and then fill the gap. So I think it's one of the areas that as a country we should dwell much on. We should fund it, and then we should do it, so that we have data which is contextual in our environment, because we really much depend on data from outside. But as you can see, the trend has changed. We used to believe that maybe these diseases are for maybe the rich and whatever, but then we have seen that a lot of people in the rural areas are suffering from this disease. And according to the research that I read somewhere, it stated that out of maybe 2000, about 2300 people who were visiting the hospital, about 40% of them, it was they had NCDs, one of the NCDs. So it's really a big area where we have to research on and to see what are the contextual risk factors in our setting, contrary to those we read from maybe outside literature. Yeah.
So why do you think that in Malawi we don't do such researches, or we don't have such researches?
It's either we do not have the people who are very much invested in this, or we have more problems that we are dwelling on other than NCDs,
Other than
or funding, because research needs a lot of money. So if we could have people, because some of them, let's say diabetes, someone else would specialize and maybe do endocrinology, and they would do a research in maybe things like diabetes, thyroid diseases. Okay. So if we have such kind of people, I think research should be done. But yes, researches are being done, and I think we should have data uh, in short time coming. Yes.
Okay, just like in each and every single field, people have challenges. So, what are some of the challenges that, you know, you people, specialists who deal with the NCDs face?
Yeah, I think the biggest challenge would be finances, money. We do not have enough money to conduct the research, to treat, and maybe do some campaign programs which can help prevent these diseases. For example, the screening programs need a lot of resources because in screening programs, we are dealing with people who are not even suffering. Okay, so we weigh, should we go for and help the people who are not even suffering to find out whether they're suffering or not, or they will suffer or not, and then leave someone else who is suffering in the hospital. So we'd rather go for those people who need their hope more than the people who are looking okay. So if we had more funds, we would do screening for the cancers, for the diabetes and hypertension, and that would help us a great deal to prevent these diseases or treat. Another problem I think we have is it's not much incorporated into the system of our education. Most people will learn about NCDs because either they have gone to the hospital or maybe they have listened to a certain program somewhere else. So education, the information is not disseminated as much. Um, would rather have everyone else learn about NSDs in their respective whatever schools or programs so that they know what it is and how they would prevent it, because these are diseases, I would say worse than HIV somehow, like diabetes and hypertension. These are diseases that someone live with them, and they can even die earlier than some of the chronic infectious diseases. So these are the challenges that we have. Okay, so we need a lot of stakeholders in this sector.
How can we measure the impact and effectiveness of NCD interventions and programs?
Yeah, that's so. I think you have to come up with the metrics.
What are the metrics?
So these are things that you, okay, they're like your measuring points. Like to say, okay, for example, before the intervention, you you would have set goals to say this is how far we want to go. This is the number of mortality we want to reduce. This is the number of incidents we want to reduce to. This is the number of maybe of patients who would have helped by this number, by this length of years. And then whenever the intervention has been made, you do now monitoring and evaluation. You go back to your goals, your objectives, and then look, have they been fulfilled? How much have you done from what you planned? So I think that's the simplest way I would put it. So you come up with metrics to say, okay, we'll look at mortality,
Mhm.
we'll look at maybe the incidence, we'll look at the number of patients who have treated, or the number of hospitals who have reached out with a certain intervention or education, we'll look at number of schools who have educated, we'll look at number of health professionals that we have educated into NCD program. And then at the end of that period, you look at it, okay, have we reached that number we said we would reach? Okay, it was 15, we have done 10. So it means there you have a failure of 5. So that's how you'd measure. You have to come up with milestones that you would count to say, this is how much we have achieved, and this is how much we have failed. And the next time, where do we improve? What do we do so that we reach the goals that we said? And first of all, the goals have to be measurable, they have to be specific, they have to be something which is time bound, and something that it's practical. Yeah.
So, do you think people should get more information about NCDs than malaria or HIV and AIDS?
Okay, I wouldn't compare to say maybe we need more education on HIV and AIDS and malaria. Okay, but then this is equally important. People need more information because a lot of people don't know how hypertension comes about. Okay, a lot of people don't know how maybe diabetes comes about. How would someone still live with diabetes? Because we have had patients. At least people understand that you have to take the ARVs for the rest of your life.
Yeah.
But a lot of people do not know and do not understand that you have to take your diabetic medication maybe again for the rest of your life.
Yeah.
So we need people to understand that, to say they have to control their sugar levels. But most importantly, they have to prevent the disease itself before it starts. So we need information about all the diseases. But right now, the part which we are lagging behind is the NCDs. Yes.
Yeah, I feel like NCDs are very underrated. I feel like they're not much talked about,
Yeah, they are not.
unlike
We
malaria,
yeah, we
AIDS.
talk about malaria because when a woman is pregnant, she'll hear about malaria at the hospital. When the child is just born, they'll be given a mosquito net. Like, they'll hear about malaria. Everyone knows about malaria. You see a mosquito, all you think about is malaria. Okay,
Yeah.
so it's something that something of I don't know, common knowledge, I should say. It's something that has been really taught. So the way people know about malaria, we want them to know about diabetes, about hypertension, about stroke. Maybe you may not be the one suffering from it, but then if someone else is having it, how can you handle them? How can you handle a relative who has stroke? They'll not always be in the hospital where we help them, but they'll be at home. How do you help them? So we want people to know that.
So, do you think that people don't have much information about STDs just because it's rare?
I would say because of the change of demographics, because there was that point in life where these diseases, especially diabetes, maybe hypertension, the strokes and others, were much linked to a certain economic status.
Yeah.
So they were common in the developed countries, unlike here in Africa or in Malawi where we're just developing.
Yeah.
It was associated with the rich. Okay, you are the rich. You are rich people. You eat a lot of fatty things. You you are exposed to other food stuff and other lifestyles like smoking and drinking, unlike to the people who are poor. Okay, but now things are kind of turning around. You see a lot of diabetes even in the poor people. Okay, no, let's say poor, but less developed people, maybe from the rural areas, they're also suffering from these diseases. So that's what we are trying to do, to say these people need that empowerment through knowledge as well.
How can people get involved in NCD advocacy and awareness?
Yeah, so there I think we'll tackle according to the groupings of people.
Yeah.
Um, the healthy personnels, they have to educate their clients, either patients or just people maybe in their community. So we should have that kind of system where we impart knowledge to the people who are closely linked to the people in the community, who can educate the people in the community. For example, we have what we call health surveillance assistants.
Yeah.
Those people who work in the community, those ones can come in handy and educate people. Okay. Now we have the policymakers. Those ones can come in and set policies that will help us prevent, treat the diseases, or have enough resources that can help us to run programs pertaining to these NCDs. And then we also have the people themselves in the community. They have to be active. They have to be proactive. They should be willing to learn. They should ask for what they want to know, so that the government or the health sector can provide such kind of assistance to them. Many of the times that people just wait, but they can initiate something. They can also participate in these programs so that we fight against the NCDs. and even the religious sector as well. Uh, I don't know about other religious sectors, but the other denominations have maybe health department where they look about the health, they talk about health. So they can also talk about the NCDs to their members of that denomination so that people get equipped, whether at church, at school, at the hospital. I think in that way they'll have a full understanding of the NCDs.
Okay, so you're talking about technology, right?
Mm,
That's part of our resources. I mean, NCDs need
mm,
resources, right?
mm.
So in Malawi specifically, do you have enough resources, like so that you can treat NCDs?
Yeah, I wouldn't say we have. I think we have few of those. We have little, and we need more of it. Yes.
So how do you manage if you have few resources? And I feel like there are a lot of people who are suffering from NCDs, right? So
Mm.
if you have few resources and a lot of people, how do you manage to?
So I think here in Malawi you usually uh, work under scarce resources. Uh, Even in my area, even you talk about maybe uh, in labor or whatever, each and every one will tell you that they have little resources, and that's the biggest challenge that we have. That's why we say the health sector needs to be fully funded. Like we need a lot of finance, a lot of funds, a lot of money, so that we run our things smoothly. Otherwise, we work with very small budgets and we go by it. And there's little that the health providers can do other than relying on the policymakers and the people who allocate the budget. So that's how we work. We work with little resources all the time, all the time.
So isn't that a burden to you
It is a
personally?
burden and it is a challenge towards this campaign of NCDs. And it's something that we have to address as we move forward.
That's it for today's episode. I hope you have gained more knowledge on NCDs. Until our next episode, I'm your host, Nes Nurenda.